Welcome to our podcast. Today we're going to have a brief overview of available community resources for patients with chronic hepatitis B. My name is Chantil Jeffreys. I am a nurse practitioner in the Memphis, Tennessee area. I have been practicing in GI and hepatology for the past 24 years. I do clinical research and clinical practice, as well as I'm the APP clinical director for 31 APPs in my system at Gastro One. And I'd like to welcome everyone and thanks for joining. Would you like to introduce yourself as well, Tuesday?
Of course. My name is Tuesday Werner, and I'm a nurse practitioner here at Mayo Clinic Arizona. I actually do transplant medicine hepatology for over 20 years. And I'm very excited to be a part of this conversation with regards to chronic hepatitis B and available resources in our community.
So our main focus today is the importance of connecting patients with support systems in order to improve outcomes for these patients. I'll ask you first, what are the local and national resources you often use for your patients or recommend for the patients to look into or to explore to give them some support?
For sure. So this is very important and to emphasize that whether the patient is newly diagnosed or have been living with hepatitis B for some time, I want to emphasize that they are not alone and that we are here to support these patients and, of course, be involved throughout their journey and help them with all the resources. So first, I want to emphasize this medical support, the availability of the liver clinics and the specialists, the importance of screening, vaccination programs, and as well as the treatment guidance for medical support and care navigation, finding a nearby hepatologist or liver clinics that specializes in hepatitis B treatment. For screening, of course, and vaccination, there's local clinic offering free or low-cost hepatitis B screening and vaccination to family members, especially those who are at risk or high risk. And there's also treatment guidance, including educational sessions and antiviral hepatitis and at-risk individuals. So educational resources should be available to patients, including workshops and webinars and educational resources by healthcare providers. Also management of their nutrition and, of course, including most recent research about this disease. And also there's importance of the availability of printed multilingual brochures, fact sheets, and, of course, videos. Most importantly, counseling, the availability of support group, whether it's virtual or in person, that they can share their experiences and also ask questions and encouragement for patients who are also have this disease. Mental health access is also very important, right? Culturally sensitive counseling and address stigma, stresses, and emotional well-being. So in addition to that, there's other resources that we can go through as we talk further. Yeah.
Absolutely. I completely agree with you. And, when I was doing a little research for this podcast, I've been doing this a long time. You kind of get into your own status quo and, you have your own way of doing things. And I just thought maybe I'll take a look and see what's out there for our Hep B patients. And I did find a great variety of resources, more than I expected, actually. There's not a lot locally in the Memphis, Tennessee area, but we do have a Shelby County perinatal hepatitis B program that aims at prevention and screening, and there's a case manager that can get involved and assist patients that are diagnosed with hepatitis B.
Right.
Online, there are multiple groups. I really like this Hepatitis B Foundation because it really stems out and gives a lot of different avenues that you can explore for healthcare providers and for our patients as well. So I thought that was really interesting. And I found one called the Hepatitis B Alert Group. Mm-hmm. It's a Facebook group for patients with hepatitis B, and it has 6,200 members. So they can put input into nutrition, different things that they've done to help improve the quality of their life. Mm-hmm. They also have videos and nutritional videos, treatment videos, and update videos to help with that. Of course, the American Liver Foundation has online support groups as well.
Right.
You've sort of gone over a bit about the education. What do you think about advocacy? Do you think we have enough advocacy for our Hep B patients?
I believe we do, but we need to do more. So advocacy and access to support groups is really important. So as you said, American Liver Foundation, they're one of the group that provide education, advocacy, and access support groups. There's also the CDC. I forgot about that. The CDC hepatitis B information. They have these up-to-date medical guidelines, vaccination information. And again, as you said, Hepatitis B Community Forum. So these are all great organizations, but I believe each one of us as health providers need to advocate for the patients, and whether it is local or national, we have to, get in contact with our senators or people that are engaged in the White House.
Absolutely.
There's a lot of needs to do that. So we can start working on just disseminating all this knowledge that we have. Let me ask you, as we have here locally in Arizona, we have this Asian Pacific Community in Action group that also helps with the immigration, all this education for the high-risk population. The Arizona Liver Health is there. As you mentioned about the prenatal, we have the Planned Parenthood at Arizona that also offers hepatitis B screening and STI or sexually transmitted infection screening and also assistance. And we have this, what we call, I think it's national, this, or maybe it's just ours, I'm not sure, but it's the 211 Arizona, where you dial and search or search online and find local support groups, clinic, transportation assistance, and food and housing resource. So that's what we have.
That's incredible. I've not heard of that one, and I definitely don't think we have anything locally like that.
Maybe there is 211, but it's like 211, Tennessee, not Arizona.
Oh, yeah. It could be. I don't know.
Right.
How do you help patients know where to go? How do you steer them towards these different programs and resources to help support them through their treatment?
So I think, first of all, patient needs to be educated. They need to learn and know and actually be aware of what hepatitis B is and what it does to them and how to prevent them. And letting them feel empowered by letting them know that they're not alone. And then once they get to that point where they educate them and they're ready, I think that's the most important time to show them the resources available. So, as we mentioned earlier, there's phases of readiness, but I believe just getting into that resources right away and let them know about what the complications that can happen and that they're not alone. I think that's one of the most important things that we need to do to have this patient engage and capture, make sure they're compliant with their medications and, the treatment.
I completely agree. And I like the way you said it, that you as clinicians, we need to educate the patient first and then provide the resources because, sometimes patients will get out there on the internet and they just get overwhelmed with all the information that's there.
Overload.
And I think if we can provide that, that base knowledge so that they know what they're looking for, then they're better able and feel more comfortable navigating those resources.
Right. And in addition, we have to be mindful of their cultural background. Even though they speak English, but culturally, they haven't really grasped it. So it's important that to provide all the materials, interpreters, everything that culturally that will click to them, because that's one thing. So like I'm from the Philippines and hepatitis B there is just everywhere, and when we do immigration, they test us for hepatitis B. But yet we were never told that, okay, you have hepatitis B, but here you go. Here's your visa. Have fun or good luck. But then I realized, they don't test the viremia. They test you if you have Hep B or not, or if you're vaccinated or not, but there's not really a follow up on what to do. So a lot of immigrants that come here, whether they're from Vietnam or somewhere in Asia, and, I work in a transplant center. So by the time we see them, they have this big liver cancer they're not qualified for transplant. Now, these are the patients that we really, really do need to capture because once again, they feel great. They don't care, they didn't know they have the virus. So it's very important to educate them and to capture this high-risk population.
I agree. And it's also, I think it's important to establish that support system for each patient and a culturally relevant support system. So in my area, there are quite a few Vietnamese patients that I see on a regular basis. Been seeing them, a lot of them for 20 years. They have like a spokesperson. She's always been the advocate for them. Yeah. She brings them to their appointments and translates oftentimes. And she actually, over all this time, has gained some medical knowledge on her own because of all the translating that she's done. And she'll ask questions about what that means. So I think it's important to identify those resources that are out there for specific communities. Yeah. And, whether it be a church-based resource or a community-based resource, we need to know what those are out there so that our patients are getting help to get support for this illness.
And as you mentioned, the advocacy earlier, it's really important to fight the stigma that comes with hepatitis B. To go with the bills and community support to have this patient also be more engaged and responsible for their health. Especially on their place of immigration. If there's a lot of Asian there, talk to their families about their disease to make sure that everyone gets screened. Also talk about misconceptions about this chronic hepatitis B. So it's really, really important to have this advocacy effort to raise public awareness, prevention, the management, and potentially the casual, how you can get Hep B. So some people really doesn't want to talk about it, but it's a part of life. It's not just your fault. It's no fault. We need to raise that stigma. And once again, the improvement of funding and and also research for this, hepatitis B programs.
Yeah, it seems like they haven't done a lot of drug research for hepatitis B in the last, several years, decade or so. So that kind of, I think, decreases some of the funding, not only funding, but also the awareness of a specific illness. We're in a country that now they vaccinate children, with hepatitis B vaccines, but we still have to realize not everybody was of that age. I'm not, I was past that that point where they started vaccinating. So you have to really think about it. There's still those patients out there, and there is a great stigma for any hepatitis, it seems.
Exactly. Yeah.
Still people, I'm in the deep South, people don't like to talk about their illness. They think anything to do with the liver has to be alcohol, because there's still that mindset that cirrhosis only comes from alcohol. So I think the awareness definitely should be raised regarding that. And that's what we do as advocates for our patients.
Right. I remember, so I don't know if we're almost closing here, but one of my patients really told me, at first I didn't even want to tell my family. I felt ashamed. I'm confused, like I've done something wrong. But then I joined the support group, this patient says, and basically heard all the other stories and like patients like me. And then I realized I'm okay. I'm not alone, and it's really powerful to say that. So I think,
I totally agree. Yeah.
we have a lot of things to do, but we're going to get there. We're just going to need to understand and, put shame into empowerment to patient and give them the power to take care of themselves.
I completely agree. Do you want to kind of wrap us up and recap some of the things that we talked about?
Yes, sure, of course. So thank you all for listening to our podcast. I want to emphasize that once again, hepatitis B is a chronic disease, and there is management, there is treatment available, there is support group available locally and nationally. We have the national resources, including the Hepatitis B Foundation, American Liver Foundation, at least here in Arizona, the CDC Hepatitis B information, some of the Asian Pacific community, and Planned Parenthood, as you said, perinatal care, the 211 Arizona, and of course, importance of advocacy and just going through, all the bills and leadership and politics to help with the funding and dissemination of education. And of course, find your local hepatologist or GI for help and for information.
Absolutely. Thanks for listening to our conversation, and encourage your patients to go out there and get more education, and encourage yourself as a clinician to help promote these activities and improve advocacy and education and support for our patients.
Thank you.
Thank you.